How's it going, guys? Dr. J here, osteopathic physician. I'm obsessed with natural and alternative medicine and also men's health. And in this video, I'm going to be talking about hair loss and hair loss prevention, specifically for men. So if you fit that category, grab your pen and paper. This one's going to be for you. And it's going to be something I guarantee you haven't heard anywhere else from anywhere else, because it's a 4-step treatment that I kind of developed myself through a lot of trial and error and experimentation. Some of these treatments are FDA approved, some of them are not. However, and as you're going to learn in this video, we're going to talk about the risk to benefit profile of each of those treatments, and it's also going to be a little mini series, so you'll be able to learn about each one. But these are treatments that I use for myself, that I recommend for friends and patients, and by the end of this, you're going to be able to decide if they are for you. Now, the goal of this video is so that you can stop your hair loss now, because it's much easier to stop it than it is to regrow hair. However, if you follow these treatments, I can damn near guarantee you're going to be regrowing hair as well. Now, I'm not going to be selling you anything in this video. This is all going to be choose your best product. I don't make any money from this. This is just giving my knowledge to you so you don't have to suffer the same hair loss that I started to encounter. Right here, I lost about 50% of my hair volume. In the front, I was thinning and I reversed it in only 2 months. And hopefully you're gonna be able to do the same. Granted, take everything with a grain of salt. Every patient is different. They respond different to different treatments. And a lot of these things are going to be very experimental in nature. A lot of them have been proven, but let's just learn about them now, and then you're going to be able to make an informed decision for yourself. For all the medical professionals watching this saying that I am peddling treatments that are experimental and not FDA approved, I ask you, what is the risk? What is the cost? None of the things that I am asking you to go buy or try are very expensive or painful, except for one. So I ask you, what is the risk versus benefit? If the benefit is keeping your hair, keeping your dignity, keeping your confidence, and the risk is spending a little bit of money trying something that has worked for people, let's give it a shot. In the follow-up videos, I'm going to be breaking down each individual treatment, the risk and benefit profile of each of them, and the side effect profiles and things of that nature, so you can really understand what you're getting yourself into. But purpose of this video, we're going to go over the 4 treatments that I use and the theory behind them. Again, this is not anywhere else. This is not a program that is written down or recommended by physicians. This is me through years of experimentation and research on my own. All right. So without further ado, I also want to ask you that if you enjoy the content of this video, you found it helpful, even if you found it refreshing, please hit the like button and please subscribe to the channel and hit the bell notification for more. All right, let's get right into the meat of the video. What are the treatments? And yes, I do use all of them myself. I use them together. I believe they're synergistic. If you use 1 or 2 of the treatments as recommended now, you might get benefit. You probably will get some benefit, but I believe these treatments are best used together, and you'll see the best results if used together. They're synergistic. However, if one of them is too expensive or too painful, highly recommend using the other 3. Okay, let's get into it. What are the treatments? So the first 2 that I'm going to mention are recommended for male pattern baldness, and they are FDA approved so that you'll know you're taking something that's safe and proven for efficacy. However, they do come with their own side effect profiles. The first 2 treatments that I'm going to mention are a staple for everybody that can tolerate them, and they are 1, Finasteride, also known as Propecia. This is an oral medication that blocks DHT, which is the cause of male pattern baldness in most cases. So I take this in a 1 milligram pill once a day. This is a very affordable medication. It is prescription medication, so you have to get it from your doctor, and it comes in multiple dosages. I take the 1 milligram because I had to scale back. I was getting some side effects from a higher milligram dosage. So definitely keep that in mind. The main side effect here is male impotence. You do get some erectile dysfunction if taken at high doses. For some men, again, I believe this is underreported. So definitely something to look out for. but a staple for male hair loss therapy. The second form of therapy that I would recommend is the topical Minoxidil, also known as Rogaine, is the popular trade name. Now it comes in a couple of different forms. I have a direct squirter. I don't use the name brand. I use an over-the-counter Minoxidil. Squirt it on my problem area once a day. You can use it twice a day as well. And this will essentially dilate the follicles, allow those hair follicles to come out. And I believe also allows the other treatments to penetrate deeper and work a little bit better. One of the side effects of this one is you may lose some hair as soon as you start using it. Those dead, dying hairs may fall out. Be like, oh my God, I'm losing my hair. But eventually it'll start regrowing thicker, stronger. And also need to mention this before I go any further. If you're gonna start a treatment for hair loss, this is something with you for life. You don't just start and stop, because you will regress and go back to a point where you wouldn't have even started. You will lose your hair. Okay, moving right along to treatment number 3. 3 and 4, I will say, are not FDA approved, still relatively experimental, a little bit more expensive and a little bit more painful. So I'm gonna go into number 3, and this is infrared laser therapy. I have a helmet that I put on for 7 minutes every night, delivers infrared light into my scalp, into the hair follicles, and this, in theory, stimulates those hair follicles to regrow, causing more hair volume. This is approved by the FDA for safety, but not efficacy yet. I think if this used alone is probably not going to give you much results. But again, it's a relatively affordable treatment, about a $500 one-time investment on Amazon. Use it for about 7 minutes a night, causes no pain whatsoever, and I believe works synergistically with the other treatments. So definitely worth a shot, worth considering. I use it. I'll drop the name for the one that I use. Again, I don't sell these, I don't make any money. Treatment number 4, and this is where I lose a lot of people. I understand if this is not something that is for you, and that is scalp PRP injections. These are platelets. They take your blood as if they were going to test it at a lab, and then they put it into a centrifuge, which separates the platelets from the red blood cells. They then take syringes, like 10 syringes full of your platelets, which are full of growth factors, proteins that stimulate growth, and they shoot these back into your scalp where those hair follicles are located. Now, this does stimulate growth for dying hair follicles, so you may and will see some regrowth from dying hair cells. This is where you may actually see some regrowth, not just delayed loss, not just stop loss, but actual regrowth of hair follicles. This is more expensive, this is painful. I get my treatments on Groupon. I get them for about $300-400 a piece. I do it once every 3 months, and I've seen really great results from it. When I first started, I was doing it once a month for the first 3 months, and now I'm doing it much less frequently. This is very painful. They do give you a lidocaine nerve block for the scalp, so you don't feel it as much. That nerve block hurts, and the rest of it also kind of hurts. And it's quite a bit of blood. For those of you who are scared of needles, have that needle phobia, this might be where I lose some of you, and that's okay. If you can do the other 3 treatments, great, but if you're serious about hair loss and you have a budget, I'd highly recommend looking into Scalp PRP and go on Groupon, type in Scalp PRP, see if there's some good deals around you, because this can normally cost upwards of $2,000-3,000 a treatment if you do this at your local med spa. Okay guys, those are the 4 treatments. In the next videos, I'm going to be breaking down each individual treatment so you can see a little bit deeper about how it actually works, those side effect profiles, the cost, where to book them, what you should look for, and some of the results that you get from using those. But for the purpose of this video, I just wanted to break down the 4 treatments that I use. Again, I've been doing this for about a year. I've regrown 100% of my hair loss. It is almost completely back. A lot of my friends, colleagues, patients that have tried similar routines are doing very well. And I talk to a lot of men who are disheartened by trying something for a month or 2, not seeing results, and giving up. That's not the way to do this. That's not the way to approach hair loss. You need to be in this for the long run, and you need to throw the kitchen sink at it. A lot of times 1 treatment regimen isn't enough. A lot of times 2 treatment regimens isn't enough. Depends how aggressive you want to be. So I will say, if you've given up, try my treatment protocol. Let me know your thoughts. And in the comments, would love to have a good educated discussion with any medical professionals that are interested in talking about hair loss. I love the topic. I love helping men that are facing this issue because it is a confidence thing. Men, we don't want to lose our hair. Our hair is precious to us, especially me, especially you. I know how important this is. So if you found this valuable, please drop a like and please subscribe. I would love to hear from you. And if you want to send me a message on Instagram, I'll do my best to point you in the right direction wherever possible. Okay, guys, without further ado, thank you for joining me in this video. I hope you found it helpful, and I'll see you in the next one.